Welcome back. September is Prostate Cancer Awareness Month. Knowledge is power when it comes to taking care of our health. So Dr. Benjamin Garmezy with SCRI Oncology Partners tells us more about this form of cancer.
Hello, my name is Benjamin Garmezy. I'm a genitourinary medical oncologist specializing in prostate, kidney, bladder, and testicular cancers. And I'm the Associate Director of Genitourinary Research for Sarah Cannon Research Institute. I practice at SCRI Oncology Partners in Nashville, Tennessee. Prostate cancer is a lot of different things, right? And there's even some controversy of whether or not some prostate cancer should even be called prostate cancer, because there's a huge range of outcomes based on the type of disease that you've been diagnosed with. So let's say you have a localized prostate cancer, a disease that's in the prostate gland itself. Your chance of 5-year survival is about 99% or greater, right? People tend not to die quickly from that disease. It's the risk of that late-stage prostate cancer, that stage 4 disease, where prostate cancer spreads elsewhere, maybe to the bones, maybe to the lungs, some other organ it should not be in. That's when our survival of 5 years drops dramatically and is under 50%. So we want to stress to everyone out there that prostate cancer is a very important disease, but it's also a disease that in most patients is not going to be life-threatening. Most patients, all they need is surgery or radiation. That's going to cure them. However, higher risk patients are going to need more. Those patients with more aggressive cell biology that we can learn from the microscope when we take a sample or a biopsy of that tissue, those patients may need radiation and hormonal therapy. On top of these hormonal drugs that we give patients, we're actually giving patients at Sarah Cannon Research Institute additional ways to intensify their therapy that are chemotherapy sparing, that we actually hope not only will be less toxic, but also potentially be even better efficacious-wise, which means perhaps longer survival, right? And hopefully we reach that inflection point where some of these new therapies that are involving cellular-based approaches, or you're harnessing the power of your own immune system by bringing your own immune system into the cancer, may ultimately lead to long-term remissions. So I think getting local PSA draws, blood draws with your doctor is critical. And that's different based on your risk stratification. If you have a strong family history of cancer, including prostate cancers or perhaps breast cancers, other types of cancers that may be genetically linked, then you need to start your screening earlier at age 50, maybe even at age 40 or 45, depending on your risk. And that's just with a blood PSA draw and a physical exam. Now, routinely, if you don't have higher risk factors such as genetics that you know about, or such as being in the Black population actually has a higher risk of disease and they need earlier screening. But if you're not in one of those populations, well, in that case, then we think about when should you screen? It's shared decision with your primary care provider. And to learn more, visit SCRI Oncology Partners at cancercarescri.com.
And I know there's something very close to you.
It is, yeah. My dad actually had it, not to be TMI, had his prostate cancer removed over at Vanderbilt. His two brothers, my two uncles, have prostate cancer. They're currently doing radiation instead of surgery, hoping to keep it down. But my doctor basically said, okay, Ben, you're going to get it. It's just a matter of like, now we have preventive measures, which Dr. Benjamin was kind of mentioning there. Look, it's uncomfortable for guys, I think, to think about. We tend to put off our health issues, and it seems like out of sight, out of mind. But as he mentioned, I mean, prevention is key, catching it early. So I'm going to do mine at 40, so which is soon, by the way. But I'd rather know and be able to treat it, you know, on the early side when it comes to cancer.
I mean, what a blessing it is that we can get these screenings so early, and not all of them are so invasive, even a blood test. But it's so important that if you do have family history, to get it checked out.
No doubt. And detection is so early, and they say, I mean, in some cases, it does need extra treatment. But with a lot of men, they say that it's going to grow so slowly that they're probably going to die of something else before the cancer.
Yes, I mean, you never want to have a type of cancer, but it is one that is treatable. You're right, if caught early, and again, you can treat it with radiation and other means, as he was mentioning there. To kind of monitor it.
Great information right there. And to check out other helpful tips and information, head over to newschannel5.com/letmehelp. And if you have a question, email us at letmehelp@newschannel5.com.